presenting the evidence-based quality improvement for prescribing stewardship in ICU. Short form is EQUIPS-ICU. And I'm giving an insight of what transpired at Nakasero and what are the learning points and what has this study improved in prescribing stewardship at Nakasero Hospital. This is the summary of the talk. I will talk about the overview, which I will jump because Ruth has already highlighted about Nakasero Hospital and what were interventional design for the EQUIPS, the key findings and practical implications at Nakasero Hospital, which can be applied even in other hospitals, I believe. And then also some highlights on antimicrobial prescription practices in Uganda. So I will skip this because Ruth has given a good insight on Nakasero Hospital ICU. The EQUIPS, which is evidence-based quality prescriptions in stewardship in ICU, the study was aiming at the following objectives: to determine whether a structured antimicrobial review can be implemented in low and middle income countries ICUs, and also to evaluate the impact of structural antimicrobial review on rates of antimicrobial density, redundance, and associated indication of antimicrobial utilization. So this is a study that we participated as a site for Nakasero Hospital under the leadership of Dr. Lamek as a site lead. The design, there was a methodology, but these are some of the highlights as Nakasero Hospital of how this design went. There was a study protocol, which had all the ethical approval from other stakeholders in the country, and as a hospital also, it also had to undergo another approval. And in our case, we have the PSEC, which is the Professional and Ethics Committee of the hospital, and it acts as the institutional IRB. So it had first go under that approval. And then there is antimicrobial review standard operating procedure was designed and was being used, which showed how the project is going to go, which had the site lead, the site champion, and the 2 data entrants. Also, the antimicrobial reviews were part of the study design. So it included the daily reviews of the antimicrobials by the lead people were the nurses, because we understood that the nurse is always with the patient, so the nurse understands all the drug the patient's on, including all the antimicrobials. So it was a role of the nurse to always remind the visiting consultants and intensivists to ensure the antimicrobials are reviewed on a daily basis. So we did that in collaboration with the attending intensivists. There was a red cup system data that we always entered the antimicrobial use and queries were always reviewed on a weekly basis. The monthly site reports were shared to the hospital, and we would see how our performance is going in comparison to other ICUs participating in the study globally. So this was a snapshot of how the performance was, how the data was shared based on the antimicrobial reviews that were done, and we would see how we are performing, and then we sit and revise together with Ruth and the team and see how we are and how we can best improve the antimicrobial reviews. So at the end of towards the end of the study, our ICU, this is a comparison of all ICUs and the ICU of Nakasero Hospital, and this data would always be shared for us to look at how we're performing, and we would sit and evaluate our performance and then look at the improvements. What are we not doing better, in terms especially antimicrobial density. These were looking like new terms to us because we never cared prior about which antimicrobials we are giving, the days of therapy, antimicrobial redundance rates, and the culture rates, and the antimicrobial resistance rates in our ICU. And this is the definition of the calculation matrix for the data that was shared. With antimicrobial density, which meant the total defined daily doses of antimicrobial prescribed per 1,000 patient days, as days of therapy as total number of days antimicrobials were administered per 1,000 patient days, and antimicrobial redundance rates are the total number of days of therapy where 2 or more antimicrobials with overlapping or duplicate spectra were administered to this on the same day at least 2 consecutive days per 1,000 patient days. The culture rate was the number of patients prescribed antimicrobials who had a culture sent out of the total number of patients prescribed antimicrobials. Then antimicrobial resistance rates, the number of patients with at least one resistant organism reported out of the total number of patients prescribed antimicrobials who had a culture sent to the laboratory. So these are the things that EQUIPS study was also looking at and part of the reports. So what were the key implications or the key insights for our site? And I believe all ICUs can copy from the EQUIPS study to bring up a change in the ICU. Prior to the EQUIPS, our hospital had a medicine and therapeutic committee, and under the committee, so we never had the antimicrobial stewardship committee. So EQUIPS opened our eyes, and we realized that there is a need to operationalize an antimicrobial stewardship committee, and is currently active, which it means monthly, to review the antimicrobial prescriptions in the hospital, and is a multidisciplinary representation. The antimicrobial reviews. Prior, all antimicrobials plus other medications were being prescribed on one prescription chart, and there was a risk that a prescriber might write the same antimicrobial prior looking at other, because opening the whole chart was difficult for the prescriber. There is likelihood that you can prescribe drugs doing the same thing, which are all antimicrobials. So there was introduction of antimicrobial prescription chart, which is now being used. We first used it in the ICU and have rolled out throughout the entire hospital so that we can do proper antimicrobial stewardship. Then the antibiogram, with the support from the culture rates and the laboratory, the hospital has come up with the antibiogram, which is still undergoing review, and we monitor which microorganisms are the most and which respond to which antimicrobials, so that we can know how to do right as stewardship. Then peer reviews and multidisciplinary approach. We realize that one patient is being seen by different specialties, so there is important of peer reviews so that we reach at the prescription that is benefiting the patient without contradicting the other prescriber. So peer reviews are done on a weekly basis. We have a committee called multidisciplinary team, which organizes peer reviews for each patient undergoing treatment in the ICU. And among the things we review include the prescription of antimicrobials. So what does the data talk about of other practices, antimicrobial prescribing practices in Uganda? I didn't go into deep of all of it, but a few that I got. There was one study that was done in Mbarara Regional Referral Hospital. I will not speak on their behalf, their representatives are here, but it showed that of the 109 patients who were enrolled in the study, at least one patient received an antimicrobial. That means the prescription of antimicrobials is still high in the country. And also, there's another study which was done in Uganda, Ghana, Zambia, and Tanzania, which Uganda was inclusive, the prevalence still showed high antimicrobial prescription. Also, due to antimicrobial prescription, there is also high antimicrobial resistance. The prevalence is high in the country, and therefore these are some of the studies that I came across, and they are all pointing at high antimicrobial prescription rates. They are high, even when the patient doesn't need an antibiotic per se. The patient will come in the hospital, a simple sneeze, and is prescribed an antimicrobial. It is a burden in this country. So there's need for antimicrobial prescribing stewardships in this country. This has created the burden of antimicrobial resistance in the country. We bear witness for those who are in different ICUs who have seen bugs that we had never seen before. And this is the result of poor antimicrobial stewardship that is happening in this country. And now, the government, I'm not a representative of the government, but I'm picking the data that is available. Due to the burden, some work has been done. There is one health approach. The government has looked at antimicrobial prescription and stewardship through the environmental health, animal health, and human health. And you bear witness, and some data has shown that antimicrobials are given to animals. It's true. And before we eat the meat, we are likely to consume the antimicrobials, and that will contribute to the resistance. So the One Health approach has helped to yield the country has come up with the antimicrobial stewardship, Uganda Antimicrobial Resistance National Action Plan 2024, 2025, and 2029. And we have hopes that this, if we leverage from that, we shall improve something in this country to prevent the resistance. So this is the appendix of how the study was going, and especially on the data entry SOP, which we shared with our PSEC, which is our hospital IRB, and they approved it. This is how we were doing data entry, antimicrobial reviews, and also the discharging protocol patient from the system. And also, during the study, at the hospital, we designed the daily antimicrobial review form, which is used on a daily basis to review the antimicrobials the patient is on, because we realize that it's important for every patient on antimicrobials to have that daily review. It is very important. And this is the antimicrobial chart, prescription chart I've talked about. It has yielded a lot, because the prescribers, before writing the antimicrobial, they have to make sure that the antimicrobial is meeting the indication site. One, is it prophylactic? Is it empirical, or is it definitive? So there is that kind of stewardship that has happened, that the prescriber will now take caution before he write an antimicrobial. And also, the pharmacy area, they will not prescribe any antimicrobial on the third day without the reason for the review. As you can see, this part is the review. So the prescriber will always take in caution that if I don't write the review reason, the pharmacist is not going to dispense the antimicrobial. So there is always activeness, and everyone is aware that at Nakasero Hospital, when you prescribe an antimicrobial, without the review, the pharmacy is not going to dispense it. So those are one of the stewardship initiative, and has been as a result of the EQUIPS study. So thank you so much. I believe we can all take something from it and ride and grow the antimicrobial stewardship in our country. I thank you.